Thank you very much for all of you for hanging in here so long. I'm with the League of Women Voters, and the League of Women Voters supports this bill. The League has been fighting for for equality for women ever since the 1920s. It's a national organization with affiliates in all 50 states. And we support the right to abortion. We've came to that, our positions are arrived at after intense study and careful consideration of different perspectives on issues that the League considers. It advocates for issues and is nonpartisan. It has carefully studied the arguments concerning abortion in the Roe v. Wade decision and has for 40 years supported the Supreme Court's decision declaring a woman's right to privacy. The laws that are identified in the reproductive health care bill, which prohibit abortion, are denying a woman the right to make her reproductive choices. And of course, these have been referred to before. Shouldn't unconstitutional laws be struck down the moment they become unconstitutional? And another question we have is, why aren't outdated laws deleted automatically? The Roe v. Wade decision guaranteeing a woman's right to privacy has assured her being able to have sovereignty over her own body. For government, institutions, or others to attempt to dictate what she may and may not do is nothing less than an invasion of this privacy, as well as a matter of equity. We would have to ask ourselves if it is equitable that half the population of this state and of our country should be subject to control while the other half is not. And this has, of course, been addressed before by some other speakers. For others to determine what a woman can or cannot do constitutes a type of imprisonment or slavery when she's forced into carrying to term a pregnancy she does not want and is harnessed with the subsequent responsibilities of rearing a child. We have seen the impact that it can have on women where it creates economic or psychological harm, ability to get an education or job, and sometimes these effects are perpetuated over more than one generation. We have seen adverse ramifications for her families and for the greater community. For many women, this is also considered a power issue. We have compassion for these women who are forced to come to term with their pregnancy. While Roe has for over 40 years assured the right of privacy of reproductive choices, it is under threat at the federal level. And the reasons or examples of that have been given earlier, so I'm not going to go into them. The right to privacy of choice has been for years an ongoing battle in Rhode Island, with the reproductive health care, such as the one being considered tonight, forever being held for further study, and never given the opportunity for a floor vote, despite clear and repeated evidence that the majority of citizens in the state of Rhode Island support access to abortion, as many as 70% by some measures. The League feels it is time that this bill come to the floor for a House vote and strongly urges passage. Thank you.
Thank you, Marianne. Thank you for your patience tonight.